You are 15. You arrive to your first party. Once wandering around and chatting with people, an older boy called Luke walks up to you. He offers you a drink and you hesitantly take it, even though you know the immediate consequences if you drink. Now, I am here to tell you the consequences don't just stop at you throwing up in a bush that night. I am here to tell you that you've been offered a world full of opportunities, so you should be making safe choices. Alcohol is considered a level 1 carcinogen alongside tobacco and asbestos, and more teenagers abuse alcohol than any other drug, including street drugs and tobacco. If it is this dangerous, how does regular consumption of alcohol affect teenagers' lives? More specifically, how does alcohol affect a teenager's growing brain, their behaviour, schoolwork, their long-term health, and risk-taking behaviour? The brain is growing the most from the age of 14 to 23. That's why it is illegal to drink if you're under the age of 18. Still, 75% of Year 12s at the age of 17 have drunk alcohol by the time they've graduated. So how does alcohol affect the growing teenage brain? It acts on the nerve cells and disrupts the communication between the brains and body. To break it down even further, the hippocampus forms memories, which is why many teens who drink can't remember what happened, as the memory itself actually wasn't formed. When drinking, the cerebral cortex slows down the messages being sent from the brain to the 5 senses: touch, see, smell, hear, taste, and then vice versa. The hypothalamus does things subconsciously, such as regulate blood pressure, hunger, and thirst, all things that go haywire when drinking alcohol. The medulla controls the body's automatic actions, such as heartbeat and temperature. When drinking alcohol, your body thinks you're dying, so it adjusts accordingly, slowing down the heart rate and core body temperature. Your frontal lobes are responsible for planning, forming ideas, making decisions, and exercising self-control, all tasks that are difficult to do if you're drinking. So now knowing how it affects the brain, how does it affect the way people act? Teenagers' behaviour is affected by how much alcohol they consume and can lead to having unprotected sex, therefore possibly contracting an STI or becoming pregnant, losing friends or loved ones due to your behaviour, losing money, and also increasing the likelihood of acting in a violent way. A study done found that 50% of both males and females have been drinking when they had sexual intercourse for the first time. Not only are the effects of teenage drinking relevant to when they do drink, but it can cause long-term health issues. It can increase your risk of high blood pressure, type 2 diabetes, liver disease, cirrhosis, kidney disease and failure, heart disease, loss of muscle tissue, bleeding in the stomach, lung infections, and cancers such as breast, throat, mouth, liver, esophagus, colon, rectum, larynx. So not only does it affect teens' long-term health, but their education too. Teens that binge drink are twice or more likely to miss 2 or more weeks of school a semester. Excessive drinking on a growing brain has significant neurological consequences. Alcohol damages areas of the brain responsible for learning, memory, verbal skills, and visual spatial cognition. All these skills are imperative not just to school, but life. In high school, heavy drinkers are 4 to 6 times more likely to cut class or ditch school in comparison to non-drinkers. In university, alcohol accounts for 28% of all dropouts. So not only does drinking affect you, but the people around you. Alcohol is linked to risk-taking behaviour which can harm others. Some examples include car accidents, tripping and falling, unprotected sex, drowning, fight, pregnancy, homicide, violence, sexual assaults, suicide, and self-harm. But we need to face reality. Even after I've bombarded you with facts, including 9 out of 10 teens believe drinking is not worth the consequences it can cause, there is a 3 in 4 chance you'll go out and drink alcohol regardless. So here are some top tips to make sure you make safe choices. Count your drinks throughout the night, avoid mixing with other drugs, drink a cup of water for every alcoholic beverage, talk whilst drinking as well as eating. Eating the morning after also helps restore vitamins and minerals lost within your body. But most importantly, make limits for yourself, don't feel pressures, and the safe choices are yours to make.